Hello, my name is Stephen Osei. The global health development issue I chose is HIV pandemic in Swaziland. Swaziland has the highest rate of HIV in the world. A survey in 2015 shows that 220,000 of their population are living with HIV virus. The risk factors prevalent in Swaziland is unsafe self-practices and mother-to-child mode of transmission. Also prevalent is the polygamous marriage in Swaziland, the situation where a man can marry more than one wife. The cost and consequence of this HIV epidemic in Swaziland has both social and economic implications on the country. Some of the facts about HIV pandemic in Swaziland include 90% of the people are aware of their HIV status. Out of this 90%, 94% are on HIV treatment. 87% have been able to suppress the virus. 28.8% adults have HIV prevalence. 11,000 new HIV infection cases are recorded annually. 3,800 AIDS-related deaths occur, and 67% adults are in antiretroviral drugs. Some key organizations that are playing a key role in HIV fight in Swaziland include UNICEF, UNAIDS, and Peace Corps. Other non-governmental and local agencies are also playing a key role in fighting HIV epidemics in Swaziland. Other donor countries like United States, United Kingdom, and Canada are also playing strategic role in the form of financial support in fighting HIV pandemic in Swaziland. For example, the United States is subsidizing antiretroviral drugs for pregnant women and other group of the demographics to help them fight the HIV epidemics. I will discuss specific contribution each of these key organizations that I've mentioned here are doing in Swaziland. Starting with UNICEF. What UNICEF is doing in Swaziland is scaling up HIV testing and counseling service to all government health facilities and 50% of private maternity clinics in the country. What they do is they provide funds for pregnant women to be tested and other certain group in the demographics to also be tested with so that they can know their status. This is the reason why a high percentage of the country population know their HIV status. Another strategic contribution of UNICEF is building capacity for clinical staff to provide care and treatment to help HIV-infected pregnant women and their exposed children. What they do is they educate this clinical staff on how they could protect and prevent and then treat these pregnant women who have been exposed to the HIV virus in the early stage of their pregnancy. And this is helping out in minimizing the mother-to-child mode of transmission. Another function or another strategic role UNICEF is playing is providing improved access and nutritional as well as physiological support for HIV-infected mothers and their exposed children. In most cases, the nutritional needs that these pregnant women need, coupled with their HIV status, cripple their health, and therefore UNICEF playing this key role help them to get the nutritional support that they need, the means of food, so that they do not have a malnourished or they do not have any nutritional deficiencies during their pregnancy. UNAID is another key organization that is also helping in championing the fight of HIV pandemic in Swaziland. What UNAID is doing is championing the education in creating awareness of the disease causes and how the mode of transmission and prevention methods available to those who have been infected. UNAID also is trying to mobilize the treatment options in community clinics and governmental hospitals on preventive measures that are available to those who have been infected with the disease. Peace Corps, what Peace Corps is doing is purely education on how the disease is infected, how one can abstain, how one can get treated when he is tested HIV positive, and other interesting education seminars that they organize in the country to educate people about the dangers of the disease. The challenges this organization are facing is lack of coordination between these NGOs or key players in fighting the HIV menace in Swaziland. Government and donor countries do not have a connected or coherent policy to fight the HIV pandemics in Swaziland. Each key player is fighting the pandemic in isolation, which is as a result that the country does not have a national HIV/AIDS policy, which have a strategic plan on how to fight the menace. And this, to me, is a challenge because the impact this key organization are having in the country is being done in isolation. So if the government have a clear national HIV policy, it can bring on board key players that are fighting the menace in the country to take a strategic part of that policy in order to fight the HIV pandemic in a holistic approach or manner. Some of the feature opportunities that interest me in this presentation is the opportunity that is out there that they can be implemented to reduce or prevent the high prevalence rate of HIV in Swaziland. The goal of this presentation is to find out what can be done to prevent and control this global issue. Education can be the central focus for this approach. Organizing forums and symposiums about the dangers of HIV in every corner of Swaziland will go a long way to educate people about the dangers of the disease and also the treatment options that are available to them. Mother-to-child transmission prevention is also a future opportunity that I see that if proper policies and strategies are organized or are implemented. Mother-to-child transmission prevention is also another area that have future opportunities that donor countries and NGOs can take advantage of. These donor countries and global organizations have been able to suppress the virus by using ARVs, which slow down the growth of the virus, which make it harder to spread and infect new people, which help to decrease the amount of AIDS that pass on every year. This is an area where donor countries and key players in Swaziland can utilize to prevent mother-to-child transmission, which will benefit the overall infection rate in the country. Abstinence and safe sex method is another area that is of great interest to me, and abstinence is where those who have not been infected can be educated about the benefits of abstaining from unsafe sex practices, and also a safe sex method which other countries like South Africa have been successfully been able to use by providing free condoms in their hotels and coffee shops and other areas that people can walk through and grab condoms, which hitherto were people have to pay in order to get those services. These are areas that are helping in solving the problem of HIV in other countries that were high, or that were categorized as high prevalence countries, and they have successfully implemented policies or HIV policies in their country to minimize the infection rate. And I believe Swaziland can do the same if they have national HIV policy program implemented. And some of the action plan that can help in making this new opportunities feasible include scaling up high HIV testing and counseling service to all government health facilities, and also building the capacity of clinical staff to provide care and treatment to HIV-infected pregnant women, exposed children. Also, providing improved access to nutritional and physiological needs to people who have been infected could be able to help solve the HIV menace in the country. People like pregnant women who have been infected with the disease normally have also nutritional deficiencies, and if government have policy, national policy, to provide them with nutritional and physiological support, together with antiretroviral drugs that they are taking, it will go a long way to impact their health status in the country. Below are the references that I use for my presentation. Thank you for listening.